If you've ever worked with tight hips, knee pain, or that deep nagging tension along the outer thigh, chances are the IT band is involved. But here's the thing, massaging the IT band itself, not as effective as you might think. Instead, we need to target the muscles that influence it. In this video, we'll break down 4 key techniques, both passive and active, to properly address the IT band. We'll go over anatomy, function, and the best ways to treat it. So stick around, because we're starting with the first stop on this journey, the TFL, one of the biggest players in IT band tension. Let's jump right into it. The small but powerful muscle sits on the outer hip, attaching to the ASIS and iliac crest before feeding into the IT band, which runs down to the lateral tibia. It helps flex, abduct, and internally rotate the hip. But its biggest job, stabilizing the knee through the IT band. When the TFL gets tight, it can pull the IT band, leading to tension, hip discomfort, or lateral knee pain. Start by rolling up the sheet to create a handle for your patient to grip and pull towards them. This secures the sheet to the thigh, ensuring a firm and stable hold. Next, flex the hip to shore in the TFL. Begin at the utmost part of the muscle, applying pressure with your thumb at the pad of the finger, not the tip. Then, instruct the patient to slowly glide their heel along the table for a 3-second count until the leg reaches full extension. As they return to the starting position, release all of the pressure. Work your way down the muscle in small increments, about a 1/4 inch at a time. The TFL isn't very big. The smaller the increment, the better. Repeating the process as needed. Before starting, take a moment to palpate the muscle to assess tension and track the progress. The repetition range should depend on the progress. Now, let's talk about the Vastus Lateralis, the largest muscle in the quad group, and a key player in lateral knee stability. It originates along the lateral side of the femur and inserts into the patella via the quadriceps tendon. Function-wise, it's a powerhouse for knee extension. But here's where it ties into the IT band. The Vastus Lateralis sits right beneath the IT band, and when it's tight, it can create excessive lateral pull on the kneecap, contributing to pain and dysfunction. That's why addressing the Vastus Lateralis is crucial for restoring balance to the IT band. Have your patient scoot to the edge of the table so their leg can hang freely at a 90-degree angle. From here, extend the leg to shorten the Vastus Lateralis. Start by palpating its insertion point near the patella region. In with acute pressure and then guide the knee into flexion, creating a pin and stretch effect. Work your way up the muscle 1/2 inch increments at a time until you reach the greater trochanter. Keep your movement smooth and confident. You're not working directly on the IT band, but just above it. And don't worry, we're not done with this muscle quite yet. Later on into the video, prone position, I'll show you how to work the Vastus Lateralis from the back of the IT band. If you made it this far and you're getting value from this, it would mean the absolute world to me if you would consider subscribing. But only do so if you feel like I've earned it. But hey, no pressure. If you're not ready, not a big deal. But do me a favor, give that like button a little tip open for me. That'll be rad. Either way, I appreciate you and I love you. Now, let's move on to the side lion position, another great way to work on the Vastus Lateralis. Start by locating the greater trochanter. From here, anchor a soft double fist just below it, leaving a small gap between your first couple of knuckles. This keeps the pressure off the IT band and directs your focus onto the Vastus Lateralis. Work your way along the muscle from proximal to distal, or vice versa, whichever feels more natural to you. Both approaches are effective and smooth, and feel free to do both. A few things to keep in mind. First, Make sure the sheet is securely wrapped around the thigh before you begin. Constantly adjusted mid-session can make your work seem uncertain and just unprofessional. Second, keep the leg positioned at a 90-degree angle. This helps keep the IT band properly exposed and displayed. And finally, always use a pillow or the face cushion as a pillow to keep your patient comfortable in the sideline position. All right, let's move on to the gluteus maximus, the powerhouse of the posterior chain. It originates from the sacrum, coccyx, and the posterior iliac crest, then inserts into two key areas: the gluteotuberosity of the femur and, importantly, the IT band. Function-wise, it's responsible for hip extension, external rotation, and some abduction. But here's where it ties into the IT band. Nearly half of the Glute Max fibers feed directly into it. Start by placing the leg into external rotation. This will shorten the Glute Max and make your work more effective. Next, locate the greater trochanter, which, by now, you should be an expert at finding. Position a soft fist just posterior to the bony landmark, getting as snug as possible. From here, smoothly guide the leg into internal rotation while maintaining controlled pressure. As you return to the starting position, lighten your pressure but still keep a connection to the tissue. Work your way up slowly towards the ilium, applying pressure into the glute medius along the way. If your patient isn't comfortable with direct glute work, no problem. This technique is just as effective over the sheet. Just make sure to discuss comfort levels before the session begins so your patient knows what to expect. If you come across a stubborn trigger point, switch to a more precise tool, using your thumbs or fingertips to apply targeted pressure. This can feel a little bit more acute, so you might need a little less pressure. And now, as promised, let's address the vastus lateralis from the posterior side of the IT band, prone. Start by bringing the leg into flexion. This shortens all the surrounding musculature and makes your work more effective. Next, locate the IT band and position yourself between the bicep femoris and the IT band, aiming to make direct contact with the vastus lateralis. Sometimes it's not that obvious. Using the pad of your thumb, not the tip, apply broad, steady pressure. Then guide the leg into extension. Work your way up the leg half-inch increments at a time until you reach the greater trochanter. Alrighty, that wraps up the IT band. Hopefully, you picked up some useful techniques to help your treatments become way more effective for your patients. If you found this helpful, please consider subscribing. It'll mean the absolute world to me. It really helps to support the channel and lets me keep bringing you more content like this. But either way, I appreciate you and I'm happy you're here. Keep refining your touch, stay curious, and as always, happy massaging. Love you all. Till next time, peace out.